Hi students, welcome back to biology online classes. Hope all of you are doing good at home during this corona time. So let us see what is the topic for today. On the screen you can see a picture which is getting very viral during this time in the social medias. So the heading itself in relation with the current situation. What is the current situation? That is the corona, right? COVID-19 period. So what is this? It's a type of disease or not? Yeah, of course, it is a type of infectious disease. So our topic is infectious disease. So let us see what are the infectious diseases included in our syllabus. So how the pathogens are getting spread? Through the food and water, through the insect bites, by the airborne droplets, direct contact and indirect contact. So before entering to the next slide, what is meant by pathogen? Pathogen is a microorganism which causes any diseases, right? There are different types of pathogens you can see. Parasites, protozoa, fungi, prokaryotes, virus and prion. The prokaryotes means bacteria. Then how the transmission takes place. Already we discussed infection caused by the airborne transmission, then direct contact and through the fecus, then contaminated water, then through the bloodstream. Let us see some definitions on this chapter. So what is meant by disease? It is a pathological condition of body parts or tissues characterized by an identifiable group of signs and symptoms. So next is about infectious disease. Disease caused by an infectious agent such as a bacterium, virus, protozoa or fungus that can be passed on to others. So what is meant by infection? It is the condition occurs when an infectious agent enters the body and begins to reproduce, which may or may not lead to the diseased condition. Then next is pathogen. We already discussed. Pathogens are the microorganism which causes any diseases in the body. Then host, which is an organism infected by another organism. That means when a pathogen enters to an organism's body, it can be termed as a host body. Then virulence, the relative ability of an agent to cause rapid and severe disease in the host. Then few more definitions. Endemic. Endemic diseases are the diseases which always affect over a population. Then example, tuberculosis. Then incidence. Incidence of a disease is the number of people who are diagnosed over a certain period of time. Then prevalence. Prevalence of a disease is the number of people who have that diseases at a time. Then epidemic. Epidemic diseases occurs when there is a sudden increase in the number of people with the same disease. Then pandemic. A pandemic disease occurs when there is an increase in the number of cases throughout a continent or across the world. For example, our COVID-19. So corona is a pandemic disease because it is spreading all over the world. Then mortality. Mortality is the death rate from different diseases. Then what are the agents? We already discussed bacteria, virus, protoctist or protozoa, then fungi or helminth, some animal groups which it spreads the diseases. Then how these agents can cause diseases? By producing the poison such as toxins and enzymes which can destroy the cells and tissues of the host body. The direct invasion and destruction of the host cells. And by triggering responses from the host's immune system leading to the disease signs and symptoms. Then, what is the classification? This is for your information only, not in the syllabus. Then, the classification of infectious diseases. By the duration, by the location and by the timing, it can be classified into various types. By the duration, it can be classified as acute, chronic and latent. Acute, which develops and runs, it causes very quickly. Then chronic, develops more slowly and is usually less severe but may persist for a long time. Then latent, characterized by periods of no symptoms between outbreaks of illness. Then by location, it can be local and systemic. Local, confined to a specific area of the body. Systemic, a generalized illness that infects most of the body parts. Then by timing, primary and secondary. Primary means initial infection in a previously healthy person. Then secondary, infection that occurs in a person weakened by a primary infection. So that means that after the primary infection into the same person's body, the second time the infection comes, we can call it as a secondary infection. Then here comes the examples of infectious diseases. Cholera, tuberculosis, AIDS, influenza, malaria. I added only few names. And from these, the first three are only in our syllabus. That means cholera, tuberculosis and AIDS. As the video is going to be very lengthy, I just concluded this video with the cholera only. In the next class, we will see the other two, tuberculosis and AIDS. So let us see cholera. Cholera is an acute diarrheal illness caused by infection of the intestine with the bacteria Vibrio cholerae. In the PDF notes, you can read more information about cholera. Then, what are the risk factors? Poor sanitary conditions, raw and undercooked food, hypochlorhydria, then O type blood. So, among these one, type O blood is very usually people are saying, but there is no scientific relevance. Then, transmission. Humans only can be act as the reservoirs of these pathogens. It can be contaminated food or water, then inadequate sewage treatment, lack of water treatment, improperly cooked shellfish. Shellfish means the seafood which contains shell over their body. It is because of their excretory materials cannot be washed away from their body. So when we are cooking that one, we are eating that one, or when we are eating the improperly cooked food, the excretory materials or the toxic materials can go into our body. Then transmission of casual contact. The incubation period. It ranges from a few hours to 5 days. Average is 1 to 3 days. Then what is a shorter incubation period? It is because high gastric pH in the body due to the use of antacids, means what the medicines we are using to reduce the acidity. Then the consumption of high dosage of cholera or contaminated water. Then what are the symptoms? Usually the symptoms are very mild, or sometimes no symptoms will be there. Then 75% of the cholera infection can be asymptomatic. 25% will be having mild symptoms and 2 to 5% will have severe symptoms. Then usually the vomiting, muscle cramps, paleness, diarrhea, then vomiting of the clear fluid or rice water loss from the body occurs. So if we are not taking the treatment, the death can occur within 18 hours to days. Then here you can see a severe condition or cholera gravis condition. Here the symptoms will be more severe. Then in such persons, the loss of body fluid will be very rapid rate. Then rapidly loses more than 10% of the body weight. Dehydration and shock. Patient's skin turning to bluish grey because of the extreme loss of fluid. Then death can happen within 12 hours to 24 or less than that. Death can occur within 2 to 3 hours also according to the severe condition. Then here it is written about the epidemiology. You can read it. No need to learn. Actually, it is a fecal disease. That means it is spreading through the feces of the people or infected person. When the feces is having contact with the water supply, it can get in the water supply, and the people who are having the contact with the such water or contaminated water are getting this cholera disease. So here shows the signs and symptoms. Watery diarrhea, stomach pains, leg cramps, mild fever, vomiting, sunken eyes and cheeks, means you can see the sunken eyes. Then dry mucous membranes on the tongue. Then decreased urinary output because it can cause the damage to the kidney. Renal failure as the excretion is not taking place. Then severe dehydration, shock, renal failure, and at last death can happen as the complicated cases. Then what are the treatments? Oral rehydration salts or a solution we can provide, and some cases intravenous fluid, that means in the ringer lactate type fluid we can give. That's for the severe cases. Then antimicrobial therapy we can approach. So how the diagnosis can be happen or takes place? By checking the stool. Stool means the motion or the waste which is passing the toilet. Then confirm presence of cholera toxin in the area. Then cholera rapid test dipsticks can also reveal the presence. Then what are the preventions? Comprehensive multidisciplinary approach towards water, sanitation, education and communication means hygiene awareness classes. Then basic health education and hygiene. Mass chemo prophylaxis. Chemo prophylaxis means the usage of drugs, means medication. Provision of safe water and sanitation. So here comes the end of the topic, cholera. From the PDF notes, you can read more details about the cholera and from the textbook also. Thank you for watching, and the next class will be continuing with tuberculosis and AIDS. Have a nice time. Be safe. Thank you.